Do you have any idea how many Americans suffer from diabetes? And can you think of one good reason that I, as an audiologist, would be talking to you about diabetes on this channel? Well, let's talk about it. Welcome back to You Heard It Here with Dr. Gary. Like the intro says, today I'm going to give you a little bit of information about diabetes. Diabetes is a disease that affects nearly 34 million Americans. Now that number was as of 2021 according to the American Diabetes Association. It may actually be higher today. But that roughly 34 million Americans equates to about 11% of the adult population. Those are huge numbers. Everybody diagnosed with diabetes will generally tell you they have been told to establish with a podiatrist, a foot doctor, and to make sure that they have their eyes checked every year. But what about their ears? Unfortunately, this is vastly overlooked. Diabetes can actually affect your hearing. If you are one of the 34 million plus Americans suffering from diabetes, please make a point to get your hearing checked every year. You need to know if your diabetes is causing your hearing loss to increase or is causing hearing loss if you don't already have some. In fact, diabetics are 2 times more likely to suffer from hearing loss than their age-related peers. In other words, if you're a 56-year-old male with diabetes, you are twice as likely to have hearing loss as a 56-year-old male without diabetes. Don't let it sneak up on you. Get your hearing checked. I'm going to put a link in the description below for a video I did about a year ago that really delves much more deeply into the connection between diabetes and hearing loss and some of the underlying principles. Feel free to take a watch. Without any further ado, let's get into earwax removal vlog number 88. I know that's why you all came.
And we're back looking at another crazy Q-tipper. This time when we look down the ear canal, we actually see a little sliver of space that I can slide the curette through and help to move this wax, seeing if we can keep it in one large chunk. As I pull that wax away from the ear canal wall, we're opening up and we can see the ear canal and eardrum behind it. Let's see if this all comes out in one large chunk or if we're going to have to do multiple bits of wax removal here. The texture of this wax is really sticky. As you can see, I'm holding it up next to the patient's ear. It almost takes up the whole opening of the ear canal. That is just a giant chunk of wax. I do understand that it's difficult to see when it's on the paper just how big that wax really is. All right, we just looked down there. There's still a little bit on the ear canal floor. We're just going to use the curette again to remove that, scrape it off the floor and the wall, get it out of the way, make sure everything with that eardrum looks clear and healthy. Nice cone of light, great view of the eardrum. Let's flip over to the other side and we see just as much wax, if not more. This time there's not a very obvious place for me to use the curette to move all the wax at once, so we're going to kind of have to pick our way through a little bit, giving us a great opportunity to get that wax to stick together and come out in a big chunk again. This one's not quite a boulder, it's more of a long ribbon. As I hold it up next to the patient's ear, you can see next to the ear canal just how large it really is. As we look back in, we see this little ring of wax. Beyond it, a very healthy appearing eardrum. We're just going to do a little bit of cleanup next to the aperture or opening of the ear, and then we'll just get another good view of that eardrum as this patient's ears look great.
I absolutely love it when a plan comes together. Getting that wax out of a patient's ear is very satisfying for me and provides them with the relief they were so desperately looking for. Thank you for watching. I look forward to seeing you in the next video.